I'm Dr. Fred Sutton. I'm a cardiologist at the MedStar Heart Network. As I've been in cardiology for about 35 years now, and I still like it a lot. I picked cardiology because when in my training program, I really enjoyed it more than anything else. Well, now we know a lot more about the cardiac problems than we knew 30 years ago, particularly for my aspect in cardiac arrhythmias. When I started out, particularly for rhythm problems, we had primarily drugs and occasionally a surgical approach. Now we have various different types of catheter ablation attempts that can treat a wide variety of rhythm problems. I guess the most common misconception I've seen over the years is the fact that it just affects younger people now, which was not appreciated back 30 years ago. Usually thought heart disease was for patients who were 60 years old, 70 years old. You see a different group of patients at times now. It's important to really know the patient, to have some intimacy with the patient. Having cardiac problems is a major concern with patients, a lot of emotional concerns. It's really important to be able to help them through that. I guess my most important advice would be to make sure that they see physicians if they're having chest discomfort. Well, it's not unusual for someone to have, for instance, recurrent chest discomfort and think that it's due to ulcer disease. And if they don't see a physician to evaluate that, they would never know that they actually have a cardiac problem. I think the MedStar Heart Network offers physicians various approaches to treat the underlying patients with cardiac problems, whether this involves cardiac surgery or cardiac catheterization or drug therapy. The advantages are very widespread.